years. It comes and it goes, it comes and it goes, but it just wouldn't totally clear. So we gave her some of the same hypercal tincture and some medicines to take internally, because internal healing,
the
small tablets, yes. The internal healing, made of natural herbs. The tablets are blank. When you put the drops on there, they become the individual remedies. So they will all look the same. So you have the tablets here, they look the same. What is the difference? They've been medicated differently. Yeah? So when you said with the homeopathic pharmacy, the drops I explained to you earlier, the drops are put in and they get absorbed into the tablet. And so they're different. Yeah, but they look the same. So with this, I was saying the internal healing is as important as the external healing. So you're applying externally, but you're giving them tablets internally for the body to heal from inside. Because sometimes wound can heal from the outside. Because the inside is not healing, that's why it keeps on coming back. So the internal healing is as important as the external healing. So with this woman in one of the villages, we gave her external, but we also gave her internal. When we saw her 6 months later, her leg, they called her especially to show us that it was totally clean, and it has never come back since. And yet they said they have seen this woman time to time, year after year, with the same infection. And now it's gone, and it's gone for good, alhamdulillah.
For example, somebody with complex medical condition, probably needing surgery, had done surgery. You may not be doing surgery as a per se. But then what do you do? Post-surgery counseling and therapy and...
Yes, yes. So, I mean, even in the UK, there are many surgeons and doctors that will use homeopathy medicines as well. So, for example, you know, you need a surgery, and say, right, you need to go to the hospital, and that needs to be fixed, so you need to have surgery. So we'll give medicines pre-surgery and post-surgery, which helps the healing process much quicker. So if you had a broken bone, there's a remedy called Symphytum, which helps the bone heal much quicker than if you had nothing. There's a lot of research, which people have researched with people who, say for example, post-surgery, they have been on homeopathic remedies and not been on homeopathic remedies, and they measure how quickly the healing process is taking place, and because of the remedies. And this is why a lot of surgeons will use homeopathic remedies, especially post-surgery, to help the healing process. So we will have our patients come to us, say, I'm due for so-and-so operation, can you help me with the healing process? Say yes. So we give them remedies according to what kind of operation she is having or he is having. And they will report back to you, oh, I went to see my consultant and he was surprised to see how quickly my bone healed or my wound healed or whichever the condition was healed. And we hear that time and time again.
What is your relationship with the conventional medicine and probably traditional, if you're in Africa, of course, and herbal, all these things?
Generally, internationally, it's very good. There are some conventional who will say, oh, you know, just do conventional or don't do homeopathy. Ideally, I believe we can all work together and help humanity generally. So we do have a lot of conventional doctors who do use homeopathy as well in the UK, and there are some who do not believe and do not use. It's personal choice.
Would a conventional doctor refer a patient to
if he or she,
a homeopath?
Yes, if he or she believes that.
That's a kind of working relationship.
It can be, yes. There has been. They're both kinds. So there's a whole faculty in the UK which have doctors, surgeons, nurses on board as members who use homeopathy as well. So they refer, and they can either use it themselves or they'll refer. In some surgeries, some GPs in the UK, I've approached a lot of GPs where they will say, okay, this person is depressed, I know she needs a bit more help. Why don't you go and see the homeopath as well? And so the relationship is good. It all depends. Like I said, some will and some won't. It's the same everywhere. But overall, yeah, it's good. And this is what we intend to do in the Gambia, inshallah, working with the Minister of Health, working with the government, is to create a total holistic hospital where we have surgeons, conventional medicine where need to be used, where you can avoid using, and working together.
So you've been in the Gambia for how long now?
5 years now.
5 years?
5 years, and this is my 11th trip.
11th trip?
Yeah, I'm half Gambian now.
And do you kind of plan to put up any kind of, would I call it hospital? Would that be the appropriate name?
Or some we already have
facility for...
Yes, we are ready. It's on completion. We have a center in Mandwa, in Brikama, just past Brikama. It's Mandwa Center of Integrated Medicine. The reason I said integrated medicine, so it's integrating everything together. Now that, inshallah, the vision is, that will be like a hub, not just of Gambia, but the whole of Africa. Okay. We want to bring in training, and we have the university from the UK involved with the University of Banjul, and they are starting talks and MOU together, inshallah. And it's not just us coming out, but it's training, self-sustaining the people of Gambia. So training will take place from Mandwa. But Mandwa is one center. Inshallah, with that will be a model which then can be taken anywhere in the Gambia. Once the degree training is set up via the universities, the two universities talking, there will be people coming from all over Africa to train in this method, gaining a degree from the Gambian university and then taking it back to their country. The vision, inshallah, is to get everybody connected. So, in the long term, come back to your question, yes, there's no reason why not that a hospital will work together with homeopathy, with surgeons, and doctors, conventional doctors.
Training and research in particular will be very much important in this area.
Definitely.
The more you do this thing, the more you come across new problems, more complicated problems. You need to have good knowledge of herbs and trees and all those things.
The training is really important. So that's why initially training will be started with people already trained at medical, like nurses, midwives. Initial basic training on homeopathic medicine will begin with these people. And then by the time the degree and the diploma is in place, they're already part trained on basic first aid. So it's small steps first.
In the communities that you're operating in the Gambia, what have been the most common problems?
A lot of common problems, I would say, would be back problems, skin problems, stomach ache. I think they're the top three we see a lot. I mean, it varies, obviously, from person to person, but they would be the main ones, I would say. But you know what the most amazing thing is the people. When you go, but we don't just go treat and ignore and forget. The feedback is so important. That's what makes it worthwhile coming back.
It's kind of monitoring mechanism.
A mechanism, because a lot of people, and you know, Gambia is a very safe country, and you know, with the president creating the security and the peace that we have such a warm welcome. But I don't think you get that warm welcome anywhere in the world. And a lot of people in the UK will say, "Oh, is it safe going to Gambia? You know, why should you go to Africa?" You know, and we say, and we have to counteract that, say it is. You must come to experience what we experience. Words alone are not enough. And, you know, tourists will say, yes, smiling Gambia, smiling coast of Gambia. But we see the root. We see the underlining. It's not just the smile. The smiles are coming from the heart. And when you see the people, and I'm telling you, when you experience what we experience, and the smile is from the heart, it's not just from the top, and the appreciativeness and the safety of coming here and seeing the people from village to village, it's just, there is no price added to that. It's priceless. And this is what we really endeavour, which makes us keep on coming back and to continue and to work with the government and to make this truly holistic nation and make people understand that we can help each other. We can empower each other and become stronger together. Like they say, you know, one alone is not as strong. Combined together, it's hard to break and become much stronger. I believe personally that if we combine together, inshallah, you know, we will become strong. And this is why I was very impressed with the President's alternative medicine
treatment program. Yes, we come into
I was very impressed with that, alhamdulillah, because he doesn't care what the world says. This is what he believes in, and this is what he's doing. And that's, I think, we should all have his attitude.
And do you believe that for every disease,
yes,
there is a cure?
I believe that every disease there is a cure. Because even as a Muslim, in the Quran, Allah subhanahu wa ta'ala says, for every disease I have sent down a cure. It's up to us when we find it, or how we find it. Now, the cure could come via herb, via energy, via different methods. But it has to be a natural cure to really go to the deep core. And yes, I do believe. And it's understanding that, and it's having the belief in yourself, having the belief that we have nothing to hide,